Hello, everyone. Greetings. Can you hear me? Is the mic on? Is the mic on? Can you hear me? You can hear me with, yeah, I do have a big voice. We're recording, so we have the mic on this evening. Thank you for coming. I assume there'll be some more folks drizzling in, but thank you for coming. We really do appreciate it. Our only Jedi in-person event. It's been ages since we get to, come and spend time together in a room. So I'm really pleased to be here. I'm going to make this short, but I think most of you know me. I'm Amy Hecklenberg. I'm the chair of the Jedi, the Justice, Equity, Diversity, and Inclusion Jedi Committee here at the School of Nursing. And, our committee really benefits from what everyone does. You coming here, participating. There's so many folks that do so much in the school, but our committee is really awesome too. So I wanted to take just 2 seconds to acknowledge everybody that's on the committee. Yana Blaha, she is our wonderful, fearless co-chair of the Jedi Committee. Sarah Goldthwait, she's somewhere here. I know I said, there she is. Linda Payne Hughes is here also. Chin Chang Lee, I don't believe he's here today. Elizabeth Wynn, there she is. She's back there. Tanya Von Visiger, is she here? She's filling in for Molly Oldenburg during her leave. So she has been a fantastic contributor. Meg Dorsbacher, where's Meg? She's here. There she is. She's our graduate student rep. We also have an undergrad student rep, Ariel Samuel. And Angelique Lapitan is the chair of our Multicultural Nursing Student Association. And she comes to our meetings very regularly and is a great contributor. And I also wanted to gesture to Amy Lyons. She's our librarian, and she's not actually a member on the committee, but she might as well be because she comes to all of our meetings and contributes very, very a lot. So I'm thankful for that. And then, of course, Herbie Ching Mays. She's our amazing support staff. So we have to thank her. Unfortunately, she couldn't be here tonight. But before I introduce our speaker, I want to alert you that we are recording. When we get to the Q&A section, Takesha's going to repeat your questions so that we can hear them on the recording. So we'll keep that in mind. So it's really my great pleasure to introduce Dr. Takesha Leonard. I'm going to allow her to provide more of a self-introduction, but I do want to mention that many of you do know that she is UB School of Nursing alum. She earned her BSN here in 2001, and I'm sort of like telling stories out of class, but she went to Kimball Tower because that's where the School of Nursing was. And she called me, "Where are you guys? We're in Wendy now." And I was like, "Why are you in Kimball Tower?" Because I wasn't here back then. Yeah. She's also on the verge of completing her postmaster's certification as a psychiatric mental health nurse practitioner from our program. Yay. And Dr. Leonard is one of our valued, really very, very much valued community partners, and she's going to be recognized next month for her significant support and impact on the advancement of the UB School of Nursing when she's awarded the Patricia H. Garman Award for Excellence in Service in Nursing. Congratulations ahead of time. So please join me again. Clap and welcome Dr. Takesha Leonard.
Can you guys hear me okay? Okay, thank you. Okay, well, it's good to see faces. I miss this. I mean, I'm Zoomed out. I am, virtualed out. So it's just nice to see all of you guys. And thank you so much for coming to see me today. I'm more of a stand-up talker, so you'll see me standing up a little bit. So I have to thank, of course, the School of Nursing's Jedi Department for inviting me to speak. Anytime I have the opportunity to speak, especially about something that's so near and dear to me, I do jump at the opportunities. And I just appreciate the way the School of Nursing has been working with Jericho Road and our clinic in order to establish some things in communities. And so I'm really excited about being here. I have my husband, my boys, my mother-in-law, and my sister-in-law here. So I'm really, really excited about that. So I'll tell you first what this is not. So this is not a talk with a lot of data. It's not very data heavy. And the reason for that is because I like to keep things very personal when I talk about what I do on the east side of Buffalo. I do have another talk that was recorded last month with Dr. Myron Glick at a Christian Community Health Conference that had a lot of the data that I'm talking about. So if you guys want that, I can give you that. But this is not a lot of preparation. It's kind of just from my heart and how I feel and what I do every day. And so I hope that you guys get something out of it. The reason I chose this awareness, acknowledgement, and action is because they all tie together. And ultimately, the action part is what I really want to focus on today. So I'm going to just start going. Okay. So the who, what, and why. So for guys who don't know me, my name is Takesha Leonard. I am a family nurse practitioner, board certified. I also have a doctorate in health policy and health administration. And I'm back for my psychiatric mental health nurse practitioner, which I'm super excited about. I got 4 months and I'm almost done. Thank God. Yes, it's been an amazing experience. But if you want to know my why, you can look right at that picture because that is my why. My family, my boys, it is important to me that they understand and know why mom does the things that she does, why sometimes I don't make it to every football game. Sometimes I'm at work a little bit early or I'm staying out too late. So it's important to me that they understand the power of giving and the power of just really taking care of your community well. And so it's not uncommon for people to see my boys running around Jericho Road when the schools are closed, playing with the kids in the waiting room and doing things like that, just because I want them to get a glimpse of what it's like for me day to day. So that is my absolute why. And so I'm proud of the young men they're becoming, but you know, I definitely want to get them in the path of service. So that's my why. Okay. We're going to start with awareness. So part of being aware is not shying away from difficult conversations involving race, poverty, pain, and trauma. It doesn't really matter what particular role we play. We all have to be aware of the things that are impacting our communities, our students, our families, and as well as ourselves. For me, working on the east side of Buffalo, it is imperative that I wake up every morning and watch the news. Because if something happened on the east side of Buffalo, it generally has affected one of my patients or a community that I serve. And so when my patients are walking in that day, it's good for me to be aware of what happened the night before or what impact this might have on them. So I don't know if you guys noticed, but not all patients walk in happy. They all have different things going on. And so I think part of the way that I establish a connection is by focusing first on the social things that may be impacting their health, and then we go into the physical things. And my patients, after 12 years at being at Jericho Road and 6.5 years at being at Landmark, my patients come to know and expect that from me, that they know that they're not just coming in for a blood pressure check and some medication, that it's going to be a deeper conversation. And so awareness is really important, just to be aware of the things that are impacting our communities. We have, the Afghan refugee crisis. Jericho Road was a huge part of establishing healthcare for about 350 Afghan refugees. We have the Ukrainian crisis. And even though they're not directly in that setting, you have to be aware that just the trauma of just watching that thing, those things over and over again can have some impact on our community and our patients. So understanding this, a person that comes into our office that, may not have taken their medication or maybe struggling with some other things, you have to think about what's going on in the household, what's going on in their communities, what's going on in their world, what are they watching, what's impacting their mental health. If I learned nothing else from this Psych MP program, it is that mental health is a big component of everything else that goes on in the patient's body. So I'm just so grateful to even, have that experience. So, okay. So I found this diagram and I loved it. I'm going to walk a little bit, guys. I hope you guys don't mind, but I saw this and this kind of encompassed everything that I was thinking and wanted to talk about. And I don't know if anyone else has ever seen this, but basically it's by Liz Fosseline, but there are two people that are trying to reach a goal, right? And it says, here. So this guy that's down below, he's got a longer path to travel, and this guy's got a pretty short path. But the guy at the top, and I'm not saying guy because it's a male, the person at the top is looking back and saying, look how far behind they are. They must not be working as hard. So this is the problem, because right here, this is a lack of awareness, because every one of those steps is a barrier. So the barrier is not that this person might not be working hard enough. They might not be smart enough. They might not be giving it their all. But there are things that happen in a person's life that impact their ability to reach that goal. And it is important that we are aware, so that we're not looking back and saying, yeah, everybody else in this class passed that test, but this one kid failed. They must not be working hard enough. They must not have studied hard enough. Because there's so many factors that play a role in how this patient is going to reach this goal. And so I identify this as a problem, because if we're thinking like that, then we're missing a huge part of what we need to do for our communities and for our students. Okay? Okay. So we have to acknowledge the negative impact that those barriers that we discussed on the previous slide have on those residing in low-income communities, as well as our students. And the best way that I could depict this is by talking about ACE scores. Now, some of you guys, and I'm assuming most of you, are familiar with ACE scores and what ACE scores are, but the ACE study was a study done by Kaiser and the CDC between the years of 1995 and 1997, where they did a study on about 17,000 men and women, adults. And what they did is they sent out surveys that just asked them about their childhood experiences. And it focused on things like, what was your household like? Sexual abuse, was your parent ever incarcerated, and things like that. And basically what they found is that the higher your ACE score was, the more likely you were to struggle as an adult with physical, mental, emotional, and spiritual ailments. I actually watched a TED Talk today where these ACE scores have also been associated with a higher rate, sometimes 12 times higher rate of death and heart disease, because that stress and that trauma is kind of like, the way she described it is like you're in a forest and you see a bear, and your body's natural response is that fight or flight. But imagine if that bear is coming into your home every night, if that bear is your mom or dad, if that bear is your brother, if that bear is a bully at school. Just imagine how you're always in that fight or flight mode, the stress on your heart, the stress on your mental health. And so over time, that has an impact on how we are. And so I was so kind of intrigued by this, that what I did is I did my own ACE questionnaire. So full transparency, and I don't mind being very transparent, I scored an 8 out of 10 on my ACE score. I mean, I was thanking God it wasn't a 10 out of 10, because I was like, oh my goodness, but 8 out of 10. And this was my first time ever really thinking. Now, I knew that, part of my childhood experiences had impacted, kind of who I am and who I was as a person, just because I can feel triggers, even when we're doing clinicals as a psych MP and I'm meeting with a child, and I'm like, oh, man, I remember going through that experience. So I knew that I was being impacted, but I never actually visualized it to see it on paper. So by all accounts, with the ACE score of 8, they said anything 4 and above, it's pretty much like you count them out. Like they're just like the chances of them being successful, the chances of them getting good jobs and being able to maintain good health and not being in poverty is slim to none. So by all accounts, with this ACE score, I shouldn't be in front of you guys as Dr. Leonard with a doctorate and a nurse practitioner and all these boys. I got a lot of kids, but all these boys and a marriage and all that based on this study. And it's a reputable study. They studied a lot of people. And the thing that stood out to me the most is that, when I was thinking about this, I was like, gosh, this is really probably impacting even greater our Black and brown communities, which is true to a certain extent. But the study that they did was mostly Caucasian families, and 70% of them were Caucasian families. And so what that shows is that we all have these, depending on the number, if you don't have one, you're blessed. That's a blessing not to have one. But if you don't have one, someone in your family that has one, or you have been impacted in some way by these. So it kind of took me by surprise that I scored that high. And then I thought about it and I said to myself, but what happened in my life that changed the trajectory of this? And when I think about that question, then I think about, okay, if it happened in my life, then what is my role now as a nurse practitioner, as a mom, as a wife, so that I impact someone else's ACE score? And so that is the question that I have been kind of dealing with for the past 12 years since I've been working at Jericho Road on the east side of Buffalo. So I started by defining poverty, absolute versus relative versus real. This was important to me because, people define poverty in different ways. So absolute is when people lack basic necessities for survival. Relative poverty is when people's way of life and income is much worse than the general population. Now, those were listed in a dictionary. Real poverty is what I came up with myself. That's my own definition. Lack of community, lack of hope, lack of good health, lack of social support, lack of education, lack of faith, lack of self-worth. Nowhere in that did I mention lack of money, because that's not what I'm seeing as the problem on the east side of Buffalo. I'm not saying that it's not a problem. I'm saying that's not what people are coming into my office reporting. They're reporting lack of all the other things. I'm lonely. I can't go for a walk in my community because there's no green space and I'm scared that I might get hurt. My dad and mom are no longer together. My mom's a single mom and I've been watching the baby all night while she goes to work. I don't feel good about myself. I don't feel valued. I don't feel respected. So that's what I call real poverty. And I believe that it's real poverty that we need to kind of take a hold of in order to change the trajectory of those ACE scores. As an aside, when I came to UB, I was 17 years old, 1996. I'll never forget it. There was something, and I don't know if you guys still have this because, Kimball Hall is no longer the nursing school, I found out today. So I was in Porter Quad. Is there still a Porter Quad? It's like a residence facility. It was a dorm. And the quad was 4 beds. So there was 2 on this side, 2 on that side, big space, and you all shared this room. So I got there early, and when I walked in, I met my 3 roommates. So Helen, who was Korean, I'm Black, and then we had Lynn and Kerry, who were both white. And we just stood in the middle of that room, y'all, looking at each other thinking, is UB serious? Like, are they really serious about this? So what I realized in that time, first of all, they are the most amazing people. So whoever, thought process was, let's put Takesha in a room with a Korean girl and 2 white girls. I mean, that was awesome because I think it made me a better person, but I also think it made them better people. So what I realized in that little quad is that everyone besides me had a mom and dad that lived together. I was being raised by my grandmother, and I had to work in the morning, 6 o'clock to 8 before my class started at something called Hubie's, if I'm not mistaken. I was making sandwiches. I just remember being a really good sandwich maker. I was great at it. And then after class, I worked at night at the little space in the dorm, at the basement of the dorm, in order to kind of supplement things and buy little things. But they had allowances that they would get every month. So, I was the only one in the room working. And I mean, they respected it so much, but I didn't look at it as something that should be respected. I was angry. I was mad. Like, how come I can't get an allowance? I called my grandmother. She was like, I don't have any money to send you. I can't do it. So I thought about like all the people that I had surrounded myself with at UB, and UB, the beauty of it is that it is so diverse and you do get to meet a lot of really great people. But a lot of my Black and brown friends were in the same situation that I was. And a lot of my white friends and Korean friends and Asian friends were not. And so when I think about real poverty, I think about that. But what it did for me, guys, in all honesty, is it built resiliency. It built resiliency. So I had to work. Yes, that was okay. Did I make it through college? Yes, I did. Did I succeed? Yes, I did. Did all my friends that were in better situations succeed? Yes. But what I did do is I changed the trajectory for them. I changed their story and their narrative because the cycle was not going to repeat itself with my boys. It was going to stop. And so recognizing that I had all these barriers that were put in front of me, those steps to get to the same goal that some of my friends were getting to without the barriers, made me not only resilient, but made me also want to be a person that helped kind of get people there a little bit quicker. So am I sad about it? I think I was when I was 17 and I had to get up at 6 o'clock in the morning and go to class. But as a 43-year-old mom of 5, no, I'm actually grateful for that. But I also realized that UB provided me with a support that helped me kind of build my self-esteem up. So you guys had a class, and I think it was called College 101. It was taught by Dr. Takesha Thomas. I'll never forget it. And it was for all incoming freshmen. And basically, she just talked through the ropes and all the social issues that might be impacting, how you are as a student. I did not have a great high school education, but I graduated at the top of my class. I didn't realize it till you get in UB in the lecture hall and you're like, oh my gosh, I don't know half of these things that these kids know. And you feel inferior. You do. Not just because, a lot of the kids there weren't Black, but because you're like, I don't have the smarts. Like, how am I going to make it? And so part of what Letitia Thomas did was pour that into me. And I don't know if I would be the same person I was or I am if she hadn't done that. So my question and my journey is, how can we be that for someone else? So now I talk about kind of the action part. So what do? We build resiliency. Children and adults alike need a cheerleader. They need someone that says, it's going to be all right. Let's figure it out. And that is what I have kind of put myself in the communities and in the situations that I'm in order to kind of be that bridge between what's going on at home and what your possibility is. Just because you started somewhere does not mean you have to end there. Your path can change. But for a lot of people, including myself, when you're in it, when you're living in that environment, you cannot see beyond it. You cannot see that things will get better. So do I go into people's houses and remove parents and I don't do all that. What I do is I meet them where they are. I have conversations with the children, and I have conversations with the families, and I share my story. And I have no problem doing that. I'm totally transparent with my patients, because what I think they need to see is me. They need to see someone that went through it. They need to see someone that got out of it, but they also need to see someone that's in their corner. And for the past 12 years, that's where I've been. You come into my office with a situation, something happened at school. They diagnosed my child with ADHD. My boyfriend left and I have no way to pay my bills. And we start goal setting. We start figuring out, okay, well, what else can we do? And I know that's not the traditional nurse practitioner role, right? Because I'm not prescribing medications for blood pressures. I'm not taking care of their thyroid disease. What I'm doing is having conversations to try to be some sort of catalyst between what's going on at home and what the possibilities can be. And guys, I especially focus on these children. Those ACE scores mean something. Those ACE scores are like, I can see some of the times, like, if something doesn't happen to this child in this moment, that this kid's going to be in trouble. So they don't have any other resources outside of Jericho Road when they come into my office. So what can I do to help with that? It's not uncommon for parents or children to come in, telling me that their child just got murdered or something like that, or, they're having all these issues. And I think about if something happened to one of my babies, like the dearest people to my heart, I could name 5 people off the top of my hand that I would call to support me. And none of them would be my nurse practitioner. None of them would be my physician or my primary care provider. So that tells you right there that we are making an impact in that community that's deeper than just, I'm going to treat your blood pressure and your thyroid disease. And so part of this action is that we have to be present. We have to be aware of what's going on, and we have to acknowledge the impact that whatever's going on in the community is having on our patients. So tangible ways that I'm doing this is something that I learned during COVID-19, when COVID started. Black and brown communities did not have access to COVID testing. It's not that they didn't want to be tested. They didn't have access. You had to have a doctor's order. Well, what if you didn't have a doctor, or you haven't seen one in 20 years and can't get an order? You had to make an appointment online. Well, if you have no internet access, that's not really helpful. And then you had to travel, but I don't have a vehicle. I can't get here. I can't get there. And guys, I was frustrated. I was like 14215, 14212, 14211. They were getting hit heavy. My patients were hospitalized. My asthmatics were doing really bad, and they were the frontline workers. They were the nurses' aides and home health aides in the what do you call it, residential facilities, and and they were the housekeepers. So they didn't have the luxury of just taking their PTO time and staying home. They had to work. They were my single moms who had to take care of their babies. And so I went to Dr. Glick, and I was really frustrated. And I'm thinking, well, you're Dr. Glick. Like, people know you do something, get some tests, figure something out. We got to do something for the community. And we were texting back and forth, and he texted me and said, Takesha, I'm trying. Like, I'm trying. But it was like, I think it was like a defeated try, because there was just no access to testing. So it wasn't like he wasn't trying. We just didn't have it. So what we decided to do was call the Erie County Department of Health and ask them to give us tests. And if you gave us tests, we would be open to anyone. You didn't have to have a doctor's order. You didn't have to be a patient at Jericho Road. You didn't have to. If you showed up, you get tested. And so it was about 5 of us, a small committee, and we kind of strategized how it was going to work. People put up tents and all this stuff. And so it was kind of like a streamlined process. There was no way to notify the community, with the internet and stuff. So we just stood out holding signs, free COVID testing on the streets, and we were just waving it back and forth on Broadway. You would not believe the turnout. People wanted to get tested. They just had no way to do it. They had no access. There were all these barriers. So now we're holding a sign, and then word of mouth is, well, you get tested, and I mean, the first day we had 100 people, and we were just like, that's crazy. Like, Dr. Glick kept peeking down, because not only did we do that, but we started an isolation unit upstairs. So if you came on that line and you were sick, you can go upstairs and actually be seen by Dr. Glick, by a physician, and just make sure you got checked out and everything like that. COVID was so new. No one knew what this thing was doing to people's bodies. So it was just nice to have that access. And what we learned here, guys, is that you remove the barriers and you build trust in these communities, and people will come. And so that was our first lesson in that. I think to date, we've tested over 40,000 people. We've given over 40,000 vaccines to the community, because we use that same concept. You want a vaccine? We remove all barriers. You show up and you can get tested. But we had conversations with community members. We kind of opened ourselves up to learning more about what was going on in the community. And now, because of that, our Broadway office is just bustling. It's just so busy, because now people are like, we love this place. Like, we want to become an actual patient here. So when this happened, I thought about the best way to kind of enhance this whole kind of thing about moving barriers and teaching our community. And you guys know my heart is for the kids. I think I mentioned that before, but my heart is for the children. And so what I thought about is that our MAs and our LPNs are predominantly African-American, Latino, and we have some older LPNs and MAs who are great at their jobs, but they just never thought about going any further than that. And so I tried to figure out where that stick was. Like, what was it that didn't propel them? And so asking our MAs and LPNs, what was it that didn't make you, want to go further, maybe for RN or even a physician, FNP, whatever. And there was access and opportunity. That's what I got, access and opportunity. So they didn't live in communities where there was just open access to learning things about healthcare, but a lot of the community colleges went to their schools and promoted their MA programs and their LPN programs. And so they would become an MA and an LPN, and then they just didn't go beyond that, which nothing is wrong with that. I love our MAs, I love our LPNs, but what opportunities can we present to make them think a little bit further? So thankful to UB School of Nursing and Jericho Road, this summer we are starting the first high school medical mentorship program for communities of color. I am stoked about it. Like, I'm so excited about it. So I went to Dr. Glick with a proposal of 20 students, and I told him I was going to do it all by myself, and I got shot down. So we got down to 8, and now we're down to 4 students, because I can realistically, and he likes me to think realistically, and I need to do that a bit more, but realistically, I can manage 4 students. But unfortunately, we send out applications, and we got tons of them back, guys. These high school kids are wanting to have access to what does an RN look like? What does a nurse practitioner look like? And I have an African American behavioral health specialist. Our COO is from Africa. Myself, I'm a medical director on the east side of Buffalo, and I do home care. So there's a lot of opportunities, and they want to learn. They want to absorb this information. But a lot of the clinics and places and hospitals, they take RN students and NP students, but they're not interested in the high school students. But that's where it starts. That's where we start sparking that light. And so, I had a teacher from a charter school actually come to Jericho Road. He's like, I have these eight applications. And I'm thinking, like I have 4 slots, but they can apply. And it just hurts my heart to say that. So Dr. Glick said, anytime I think of an idea, I come with a form the next day and I try to, explain things. But guys, I am going to start a year-round medical mentorship program for high school students. I need all of your help. Like, you guys are all here. I'm glad you're here. Great. There's a reason behind this. I'm putting out my little pitch because it really is going to take us as a village to help our kids, especially to expand access in Black and brown communities. I mean, all the studies are showing that, a Black physician just has a better relationship with Black patients. They need to see us. They need to see us out there. They need to see us working. But I also wanted to make a point that, some of my, Caucasian, Asian colleagues, they're like, but Takesha, I'm not Black. Like, I can't do what you do. I'm not Black. Oh, no one's asking you to be Black. Like, that's not what I'm asking. What I'm saying is that whatever you do it well. You do it from your heart. You do it with passion. And if you don't feel that way, then don't do it. Because my patients can read right through it. My patients can read when you're not being genuine to them. They can read when you're putting them down, or those little subtle things. And they're called implicit biases, guys. We all have them, including myself. We all have them. I have to check myself regularly, just like, let me make sure I'm thinking in the right way. And it's okay to take a pause and say, wait, let me just make sure that I'm not biased against this, or, something like that, especially in the areas of mental health with the triggers and all that. So I definitely have to take a step back. But so, I mean, it's going to take us all, like, the schools, the community centers, all of us, in order to raise our community the way that they need to be raised. So I'm going to start this. So you'll hear more about it. It's going to happen. I haven't really presented it to Dr. Glick yet, but I think it's going to be, I think it'll work. So the one thing that I think was like drilled into my head as a nursing student was nursing theories. Guys, you guys love these nursing theorists. Oh yeah, we talk about all the nursing theorists. So, but this one, just Gene Watson. I mean, and I don't know if you guys, the Kieran theory by Gene Watson, this is what encompasses what I do day to day. And I honestly think this is what should be guiding what we all do day to day. So I'm just going to read her principles to you guys. So one is practice of loving kindness. Be kind to patients and coworkers alike. The practice of kindness, or lack of, will extend beyond the bedside. And I just have to add there that sometimes our patients are our staff. If we don't care well for the staff, they're not going to care well for the patients. So we have to recognize that our staff needs to be cared for well as well. Decision making. Keep patients first in all decisions. Realize that sometimes the patients are our coworkers and our staff. Instill faith and hope. Stay positive. Patients need you as a source of strength. Practice teaching and learning that meets patients' needs and learning styles. Involve family and visitors that want to be involved in patient education. That means meet people where they are. Meet them where they are. Nurture individual spiritual beliefs and practices. So Jericho Road is a Christian-based medical facility, but I don't pray with my patients unless they ask, but I might pray for them before they even get in the room if I know what's going on. So holistic care. Ensure care needs are all encompassing and will be met beyond the bedside. Helping and trust in relationships. If you promise to come back and check on something, keep that promise. Establish a caring presence with your patients. Guys, this is so important. This is essential in building that trust that I talked about in the previous slides. Being present builds trust. If you just dipping in to feel good or dip out to feel good, this is not the place to do it. Being a nurse is not the place to do that. People need to see that you're consistently pouring into them in order to build that trust and establish those trusting relationships. Create a healing environment. Promote expression of negative and positive feelings. Pull up a chair, sit down and listen to a patient that is clearly upset about something. Do the same for a coworker who is having a tough shift. Miracles. Believe in them. Life is one. and healing people can be one too. Okay. I'm wrapping up now. So, there's a dash between when you live and when you die. We have no control of some of that dash, but there comes a point when we do. That time varies for everyone based on factors such as your parents, your environment, your resiliency, and grit and faith. Somewhere in someone's dash is a place for us. What we do with that dash is up to us. So let's do something amazing to impact the lives of someone else. That is my definition of greatness. So I put this back up here because I have reached a whole bunch of goals, guys. I'm standing up there. I've gotten through all those steps in the meeting. So now what I'm doing, guys, is I'm standing on that platform, but I'm going back down and I'm meeting this little guy there, and then I'm bringing him back up, and we're going to meet that goal together. And that is what I'm doing every single day of my life. Okay, and then I just wanted to end with just a picture of 17-year-old Takesha at UB. I wasn't joking about this, guys. This is it. Yeah, I wasn't joking. And just looking at this reminds me of how tough I thought it was and how hard I thought it was. And then you make it through to the end and you're like, oh my gosh, I did this. So I want to give that to somebody else. And that is all I have for you guys. Okay, I'm up for questions now.
I'd just like to make a comment, Takesha, about the medical mentorship program.
Yes.
I'd just like to tell you that 20 years ago, the Buffalo Public Schools had a mentorship program. I joined it as a nurse, as an RN, now I'm an MP. But so I was assigned to a school, and so every week I would come and they'd give me a room, and students who were interested in being a nurse would come, get out of class, and I'd bring a box full of things from the hospital. They loved me. You know, I bring IVs, I bring, bandages, we learned to bandage, and they even, one time, they even gave me a bus to put 6 students